We're here today with Tina Freese Decker. She is the president and chief executive officer of Corewell Health, and with Mr. Lamont Yoder. He is the president of Corewell Health East, which is metropolitan Detroit, Southeast Michigan. Doing good. Well, welcome. How's the conference been for you all so far?
It's been very good to network and connect with legislative leaders, with people here to talk about policy issues and concerns and areas that we want to do to make sure that we're improving healthcare access and affordability.
Isn't it amazing that this broad policy conference is so focused on healthcare now?
Well, it is one of the number one issues that our consumers and our citizens and residents of Michigan have as an issue. And our effort is to make sure that we are helping people be as healthy as possible and that they can access the care that they need in an affordable way.
And, I think you've summed it up very well right there, that people talk about healthcare, about cost and about, esoteric things like affordability, but there's some dramatic things that happen every day that affect other people. And I'm sure you see some of those in your health system. There's an example too you can tell us about?
Yeah, Rich, for me, I came back home to Michigan a couple of years ago as Corewell came together, 4 years old, not to be bigger, but to be better. And that has played out in a way that's been so impactful in people's lives and community, because healthcare is much more about local community and people and the impact we make and what we can do to help them in their lives. So we have many stories of every single day what we're doing to try to save the cost of healthcare, but also impact people's lives in a way that is just so exciting and substantive. We have the latest technology where if we only have one or two surgeons somewhere in the state of Michigan, we have 21 hospitals across the state, they can help and do surgery remotely or have televisits in a way that can decrease cost and have care be accessible and more accessible, easier, simpler, faster to people in the community. And what I like about that is seeing how much that has changed people's lives over the last 4 or 5 years, but 2 and 3 decades ago when I started in healthcare as a nurse on night shift here in before it was Corewell, just hearing and seeing the impact that people's lives have had and what Corewell has done to really step up in a way that takes affordability but excellence to the next level and really make it all about people local in the local community.
Sometimes it's the little and the big things. So let me give you a little example. I was talking to one of our pediatric patients, and he said one of the most important things that we had was bingo. We have bingo Monday, Wednesday, Friday, I believe. And he said that nobody can come in his room during bingo because he must win a prize for bingo. Now, bingo is something that we put on in our children's hospital, and it is what we do because being a child in the hospital is not what you want. You want to be at home, playing with your friends, going out for ice cream, doing the things kids want to do. And so we try to make it a little extra special. But we also know that none of that is reimbursed. But it matters to the patient, it matters to the family, and it matters actually to their health and their ability to get better because they can focus on something and focus on healing in a different way. And so that's what we do at Corewell Health, is we really look at the whole person.
You just told us the big thing was the bingo. What was the little thing you had in mind?
Oh, it's I just saw this amazing new technology of the smallest ultrasound wave that we heated up to 58 degrees Celsius. Imagine that. That's like 136 degrees Fahrenheit. And we targeted the smallest part in your brain. And when the patient wheeled into this, it's just a procedure room. They were wheeled in, they had a tremor. When that wave was targeted and heated up to the brain, it eliminated the tremor. And that patient was able to walk out. They were able to hold a coffee cup and sip from it. And they were not able to do that before for 3 years. It's incredible. And so these little and small things, little and big things that we do are changing people's lives. And we do them every day, and it's incredible.
Both in the anecdotes and the illustrated stories, talk about some really great thinking. Right? Can our surgeons perform surgery if they're not in the same locale? Can we do telehealth? Can we bring in a new technology? You've got to navigate a lot of policy to get there. at the state level, the federal level, and of course, whoever might be the reimbursement of the payer. How has that journey been for you guys?
Yeah, this conference makes it all doable because it brings everybody together. We have insurers, care, coverage, healthcare providers, legislators, elected officials, industry partners, whether that's legal and construction or pharmaceuticals. And to have everybody here together talking about healthcare affordability right now makes all the difference in the world when you look at something that how can we really make things easier but take cost out of healthcare, like end-of-life care or advanced care planning. Talk to my kids all the time. They're 18 and 19. They're both going into healthcare, one into medicine, one into nursing. And I've said, in my last 2, 3, 4, 6 weeks of life, I'd rather give you more and not add additional cost, but we need to talk about it now because it's somewhat taboo in our country compared to other healthcare delivery countries and how they address end-of-life care, and we spend an exorbitant amount that doesn't really extend quality or value and very little length of time, maybe days. So that's an area where it's really hard to address those ethical issues and moral issues and personal beliefs, but we have to do it earlier in life. And forums like this afford us the ability to approach those difficult conversations and start down the road of how can we all work together in a way that can really take substantive costs out of healthcare, but make life better for as long as we can in a way that is value added for everyone. So I love this conference forum, but we've also been able to do that throughout the year by engaging those elected officials in our local communities, coming to hospitals, clinics, healthcare sites, sharing the stories like we shared, that Tina shared, and then talking about what's one substantive thing we can do together and make that incremental improvement step over step, year over year.
Sure, and they're all patients someday. And so, like in the example with the ultrasound going in and life changing, okay, not as much as being, grant you that, but still pretty important. What was the policy and reimbursement that you had to navigate to get that improved, which should be kind of obvious, but I'm sure it wasn't a layup.
It was not a layup, and we're probably still working on some of those. I should say that number one thing we always focus on is safety. Is this going to be safe for our patients and for our team members and our physicians providing it? So we always look at that. But then there's the internal processes that we are working to simplify and make sure it's easy to provide the care and easy to access the care. And then we go at it one after the other to make sure that it can be done easily across our system, across our state. There is a great example of where many of our hospitals in the state collaborated together on genetic testing a couple of years ago, and we were the first state that authorized Medicaid payment for genetic testing for newborns. And many other states have now copied Michigan. That's because we came together, we saw a need, we collaborated, we figured out the solution, and we moved forward, and then we shared it with others. There's so many more of those that we can find of adding something or taking something away that we can spread from Michigan or learn from other states, and it can really have a dramatic impact on the health care provided here.
And so I know affordability is on everybody's lips. Heard a lot today about the cost of going into denials that ultimately get approved. But leaving that aside, if you could recommend one policy change, and I'm sure you probably recommend a couple dozen, what would you like to see happen in our state from a public policy level?
Yeah, I've talked a lot about end-of-life care. For me, that's my personal passion after caring for patients for a couple decades as a nurse in the hospital and then coming into leadership roles. And that is something so significant and substantive that is hard to do, but other countries have done it better than us. We can learn from that, and it can take a significant 20, 30%, even as high as that out of cost in some hospital, what they spend each month. It goes directly to insurers and community members without a significant impact in quality of life. So, and that's really just takes a lot of education and socialization of a topic like we've seen change over the last decade, behavioral health, that is not as taboo to talk about today as it was 10 and 20 years ago. Taking the stigma out of that. End-of-life care is something that even this week I've talked to several elected officials and like, oh boy, that's a touchy subject. It's hard to address. We absolutely need to start talking about it.
Being on the Canadian border is not helping that discussion, frankly.
That's right.
And any policy as we wrap up here?
We need to remove some of the regulations that may have had a reason to be in place in previous years that no longer need to be there because either the health system is taking accountability for it or technology innovation has been coming forward. We need to create even more opportunity for innovation so that we can really focus on helping people be healthier and try some different things that will increase access and reduce the cost of care.
We've been talking with the leadership of Corewell Health, and on behalf of the Michigan Health and Hospital Association and the Common Bridge podcast and Substack page, this is your host, Rich Helppie, signing off.